JCB Quick Bite. This is Dr. Ines Vigil. She is the SVP of Transformation Services now. You have a whole new title at Clarify Health.
That's
correct. All right. Also, no stranger, been on the TCB Gang podcast and someone who knows the world well of what we are doing regarding the whole data in healthcare stuff, because she spent years and years building that before she went to Clarify. All right, real quick, Ines, number one, remind us, what does Clarify do?
Clarify is a data and analytics software company for healthcare organizations, payers, providers, and life sciences. And we help translate data into insights.
All right. What do you do for providers in your old world before your new gig?
Yeah, before I joined Clarify, I worked side by side with clinicians who were interested in using data to improve their patient outcomes. So I would work with them to not only architect data, but also ready it for analytic use, translate that analytics into information they can use at the point of care, and then work with the clinicians to apply it at the right patients at the right time for the right care to improve their patient outcomes.
All right, and you joined Clarify because?
I joined Clarify because they have a 330 million patient data set.
Good answer. That's where I was going here.
And so they have the best data set to work with. And if you're a person like me who needs data in order to generate insights that are effective and meaningful, you need a big data set. So I work at Clarify to play with the big data.
So your initial role was to do what? And then we'll talk about the new gig.
Yes, I was hired into Clarify to support all of the different Clarify teams in translating the information that they were seeing, the insights that they were getting from the data itself into actions that providers and payers could use across the US. What I do now is I now roll up my sleeves and work with those customers to get to the real action and get to the results that they're looking for.
Okay, so explain that one more time about the sort of the slight change. It's not a pivot, but it's an add in strategy for Clarify.
So when I started at Clarify, I was internally facing to help the product, marketing, sales, solutions, and general manager teams make their products better and more usable by our customers. Now my job is to work with the customers to get every bit of value and use out of what they've purchased from us at Clarify.
Okay. So what decisions are being made by providers now that were not being made, call it 3 years ago, before you showed up to Clarify?
Yeah, so it's really interesting to see physician organizations play much more in the space of being interested again in revamping all of their contract negotiations with payers. And the rates transparency data has really made that possible. And so we see provider organizations across the country clamoring for how much they're getting paid for what services from what payer and how that compares to their competitors.
So how but there's a lot of other stuff, a lot of clinical stuff as well in the Clarify data. So
yes,
I guess that's a pretty important thing because they care a lot about how they get paid. And yes, we all know that the nursing shortage, and we can all see the data on the operating margins and yada yada for providers. And I'm very sorry for them. Not really, but go on. But anyway, but what other big picture changes do you think that this sort of new data from you and other companies has helped providers do, and how is this helping doctors and patients?
One of the major differentiators that Clarify offers is the ability to benchmark. And you can only benchmark if you have a big enough data set to set the benchmarks. And what health systems don't have, they may have their own data on their own patients, but they don't have everybody else's data on everybody else's patients or even everybody else's doctors. So if what you want to see is the ecosystem of healthcare that any one organization is operating in, you need to see how your performance relates to everybody else's performance across all of the conditions, procedures, and diagnoses for every provider in your network. And so that's what Clarify offers that other companies don't,
and so
which is that ability to benchmark.
Yeah, so how does that translate into what actually happens at the coalface with a doctor and a patient?
Yeah, so what it translates to, and this is why I joined Clarify, is oftentimes when I would work with a clinician and I'd show them their data, they'd say, oh, well, that's only some of my patients, not all of them. Or, oh, I know that other physician and they're not better than me, and my patients are more complex. And what Clarify does is it risk adjusts on over 400 different characteristics on individual patients. That allows a much more precise risk adjustment for providers, and we have a 330 million member data set, so we can show any organization or any provider almost their entire patient population or enough of their patient population to actually predict trends, develop insights, and get to what is optimally or what can be improved upon for their particular patient panel.
Okay, and there wouldn't be this year at HIMSS if I didn't ask you about the impact of AI, GPT, God knows what else, on that exact thing, right? If I can tell you all the data about you and what the insights should be and perhaps what you should be doing, what's going to be the future of being a doctor in this kind of new world with the data that you bring in?
It's interesting and it's also scary because as a clinician, I think there's a lot that AI and GPT chat can do to improve the efficiency of healthcare. As a clinician, I still want to see the transparency, and that's going to be really hard to show in AI.
So you think we have to see what the hell is in the algorithm if anyone can understand.
What does the algorithm say, and how can I apply it, and how can I trust it?
We'll figure it out. We'll be figuring this out
calculation?
together. Right. We'll be figuring this out eventually in the end, some between now and the end of time. How this all works.
It's still about transparency and trust for most clinicians out there.
I think that's very well said. All right, we're talking with Ines Vigil. She is the SVP of Transformation Services at Clarify Health Solutions. Ines, thanks for your time.
Thank you.